Lots of people come to me saying, I have bad knees. To which my first response is always to ask, what if your knees aren't the real problem? The reality is your body will always do what you ask it to, even if it has to steal movement from somewhere else. If your hips are tight and not moving well, your knees will take that extra strain. They'll work overtime to make up for the lack of mobility above them. And this isn't just about knees. Do you have a stiff and sore lower back? In many cases, it's because the hips aren't able to do as much as they should be able to. Here's a quick example that you can do right now to actually feel what I'm talking about in your own body. Set yourself up with your feet roughly hip width apart. Roll your right ankle out so that you're standing on the outside of that foot, gently. Have your hand in front of you with the thumb pointing up and rotate around as far as you possibly can. Pick a reference point on the wall so you know how far you've rotated, and notice what you feel in your body. You're probably feeling some discomfort, tightness, or even pain in the mid and lower back. Now we're going to do the exact same thing, but we're going to put that foot flat to the ground. When you rotate around this time, you should notice that you pass that reference point easily as you rotate even further than you did before, and with no discomfort in your lower back. This is a perfect example of how the body will always do what you ask it to do. In this case, rotate as far as you can. But to do so, it may steal movement from another area of the body. Because the ankle wasn't able to move properly, the back was asked to do more than it should have to, which resulted in discomfort and pain. Now, in the real world, we feel that and think, oh, it's my back that's the issue. I need to go and fix my back. But if you went out and did a whole bunch of treatments for your back, you would never succeed, because it wasn't your back that was the issue. In this instance, it was a lack of mobility in the ankle. And if we can fix that issue, just like magic, I can rotate completely unrestricted and with no pain at all. So what's the solution? Instead of treating the pain and focusing on the symptoms, improve the source of the problem itself. At MHS, we do a full body movement analysis to find out what compensations are happening in your body. We then improve the movement and function in those areas. This takes the strain off the rest of the body, resulting in unrestricted movement, which reduces and in many cases completely eliminates pain. Your body is an integrated system. If we train it that way, we'll move better, feel younger, and start enjoying movement again.